Before we close, let us step back and look at the complete architecture of what we have covered today. All 6 of these anemia subtypes, iron deficiency, pernicious anemia, folate deficiency, aplastic anemia, anemia of chronic disease, and myelophthisic anemia, fall exclusively under the decreased red cell production arm of the overarching anemia classification. They all share a common upstream problem. The marrow is not generating red cells at a rate sufficient to maintain normal hemoglobin levels, whether because of missing nutrients, a destroyed marrow, inflammatory suppression, or physical replacement of the marrow space. Hemolytic anemia and external blood loss, the 2 subtypes that fall under the increased red cell loss arm, are entirely separate entities with their own distinct pathophysiology, diagnostic frameworks, and management strategies. They were not addressed in this session, but knowing clearly which category each anemia type belongs to is the foundation from which all further clinical reasoning must build. Let us do a rapid final synthesis. Iron deficiency anemia, impaired heme synthesis producing microcytic hypochromic cells, low serum iron, elevated iron binding capacity, low ferritin, caused by dietary lack in children, menstrual loss in women, and GI bleeding in adults. Pernicious anemia, autoimmune destruction of parietal cells, intrinsic factor loss, B12 deficiency, pancytopenia with oval macrocytes and hypersegmented neutrophils, megaloblastic marrow changes, achlorhydria, anti-intrinsic factor antibodies, and, uniquely, neurological degeneration of the posterior and lateral spinal columns, confirmed by an abnormal Schilling test that corrects with intrinsic factor. Folate deficiency, identical blood picture to B12 deficiency, but without any neurological involvement and without intrinsic factor pathology, driven by dietary deficiency or malabsorption. Aplastic anemia, greatly diminished but not necessarily absent hematopoiesis, profound pancytopenia plus reticulocytopenia, hypocellular fat-replaced marrow, caused by toxic agents or idiopathic mechanisms on a spectrum of severity. Anemia of chronic disease, morphologically variable across all 3 size categories, low serum iron with low or normal iron binding capacity unlike iron deficiency, mechanistically driven by inflammation-mediated iron sequestration and marrow suppression, seen in rheumatoid arthritis, renal disease, and chronic infections. And myelophthisic anemia, physical replacement of marrow, usually by malignant tumor, causing severe anemia with a leukoerythroblastic blood picture, featuring premature nucleated red cells and immature granulocytes in circulation, confirmed by tumor cells on marrow biopsy. That is the complete picture. Each anemia type has a distinct mechanism, a distinctive laboratory fingerprint, and a specific set of causative conditions. This playlist will have more detailed information in the future,